Welcome to Season 4 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Commissioner of Health in Baltimore City. Our goal is to bring scientific evidence and experience to current topics in public health through engaging interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith Rogers, producer of Public Health on Call. Today, Stephanie Desmond discusses animals and COVID-19 with Johns Hopkins veterinarian Megan Davis. They talk about what we've learned about which animals may be susceptible to COVID and which zoo animals are getting an experimental vaccine. Let's listen.
Megan Davis, thanks so much for coming back to the program.
Thanks, Stephanie. It's great to be here.
So I was really excited when you agreed to join me because I'm looking to hear about where we are at the moment with animals and COVID, a year and a half into this pandemic.
Yeah, that's a great question. And a lot has happened in the last 18 months. So, of course, from the beginning, we had a pretty good idea that there was a wild animal reservoir from which we had the spillover event that started this whole COVID-19 pandemic. And what we've learned since is that it probably was bats that were the original source. We think that there may or may not be an intermediate host. That's where the whole pangolin thing came in, and that's not yet settled. And it's also not yet settled if there was a single spillover event, for example, at the market in Wuhan, or if actually there may have been several different spillover events. There's some emerging genetic evidence there. But what we have recognized in the meantime, in terms of the animals that are susceptible, is that it is a pretty broad group. So the most recent, kind of surprise to all of us was that white-tailed deer can actually maybe get it and even potentially transmit it deer to deer, although it's not clear that they get much disease from it, which is reassuring. But we also, of course, have had a lot of focus on our domestic animals. And the biggest thing that we talked about previously was the mink variant and a lot of disease in farmed mink, which of course has implications for some other mink-related species, including those on the endangered species list, like black-footed ferrets that are a relative of mink. And the other group that we've been focused on a lot are dogs and cats, right? These are our pets. They live with us. They often will get exposed from an infected human, and some of them can get sick. Very few have died. It's certainly not something that we've seen as a maybe very large component of transmission, but it is something we've kept an eye on because we do worry about our domestic pets and we want to keep our pets, but keep them safe. And so for those who have COVID-19, unfortunately, you probably want to keep your distance from your pets just to help to protect them. And then finally, the other group that we've been thinking about a lot are the primates, those that are related to us. So things like gorillas, including gorillas in zoos and mountain gorillas in the wild, because they also are endangered populations, many of them, and we really want to try to protect them. And they've shown up with some cases and some disease. And so the biggest groups are that get disease, I would say minks and their relatives, cats, both domestic and exotic, meaning lions and tigers and whatnot. And then, of course, the great apes and other primates.
So I understand that zoo animals are being given an experimental COVID vaccine, and I haven't heard much about this. So what can you tell me?
Yeah, so vaccination, of course, is a mainstay for how we address COVID in human populations, right? So we've had multiple different human vaccines developed. We've been trying to deploy them, not just domestically, but globally. And where you have high human vaccination rates, you see often lower rates of COVID disease transmission and also lower rates of COVID hospitalizations and deaths. So vaccines work. And vaccines also work in animals. When we think about animals and vaccines, we think about two different things. The first is using animal models for vaccine development. And that's been the case for many different vaccines throughout the years, including the COVID-19 vaccines for people. But we also worry a little bit about animal health and protecting animal health. And so we've also developed vaccines for animals. There have been a number of companies working on this. I think the first one that came out was actually out of Russia. And there was, an extensive effort to do some animal vaccination in Russia, I think in both domestic and captive exotic species. Captive exotics are animals in zoos, right? So it's just like a fancy word we on the veterinary side use to refer to them. And we also think about developing vaccines for animals to help protect people, which I know may be a bit of an odd concept for some people, but we do it all the time. For example, we develop vaccines against things that might be transmitted through food, and we give them to food producing animals to make sure that we have lower contamination rates in our food for food safety reasons. And so some of the efforts have been with that in mind. And so, for example, using a vaccine in mink production helps to protect the workers who are in mink farms from being exposed. They're often the source of the SARS-CoV-2 for the mink, but then they can get re-exposed, and other workers who didn't have COVID-19 can get exposed from the mink. And so that's a really important kind of occupational safety thing, as well as being very important for animal health. So we have a double plus with the COVID-19 vaccine for animals in that it can help protect animal health and it can also help protect human health.
So how is a zoo animal going to be getting COVID?
It's a great question. So zoo animals are in captivity, which means that they're not going out, into the wild, onto the savannah and catching their own food, right? they're, in the case of the Maryland Zoo, they're right here in Baltimore. They have enclosures that have been designed to try to mimic what they might have in the wild as much as we can in captivity, but they still rely on people. They rely on people for food. They rely on people for veterinary care. There are other folks who are around. Obviously we have people who come to zoo collections to enjoy them and to learn about them. And there are many different ways, but most typically we think it is from the keepers, that if a keeper might be infected and not even know it, because we know that COVID-19 can manifest that way in people, that we can have it and even be shedding virus. Like with the Delta variant, we can shed the virus without necessarily even having a lot of symptoms. And so when they come into contact with the animals, they don't even necessarily have to have direct contact, because we know from humans that we can transmit through droplet and aerosol and on fomites. And we don't know how much of this could happen as, handlers are handling their food and putting it into the cages. So there are many routes of exposure. We think the risk from exposure to the public is less based on the distancing that's already in place in most zoo collections. So there are barriers, there are glass or plexiglass barriers. There are, wide distances or moats for a lot of these species, but the keepers have much closer contact with them.
So this vaccine, obviously it hasn't been approved, so it's considered experimental. Is it effective? Do we know?
So there are two ways that you measure how good a vaccine is. The first is that you do trials, and you do those often under experimental conditions, and that gives you a sense of how well it's going to work. And certainly the companies have been doing a lot of modeling on this in laboratory settings. And then there's how effective they are actually in real life. And so this is where you see the phase 3 trials for humans. And then once approved, they go into phase 4, where you're monitoring after the fact to make sure that they're still effective. You have lots of different studies coming out on the human side. And so what we're just now seeing, because these are just now being made available from some of the US sources, and I think the one that most people have been focused on that's being deployed first is from Zoetis. And this has occurred. They've donated vaccine to many different zoo collections, considering the critical need for protecting these species. Our exotic cats and other potentially endangered animals are in need of our kind of conservation approach. And so we really do want to protect the health of individuals, right? Not just the population, because their population is so small. And so they donated vaccine to many different zoos. And I think quite a few have begun this to date. We, have been focused on the Maryland Zoo because it's local to us here at Johns Hopkins. But the Philadelphia Zoo, Oakland Zoo, San Diego Zoo, Denver, Detroit, Atlanta, there have been many others that have participated in this process. And so what we'll be watching for is the data that they collect over time in terms of how long immunity lasts in these animals and also how effective they are under real world conditions to protect these animals from COVID-19.
The conservation angle is very interesting, right? Because we know that as a population, humans have really created a lot of endangered species. And so I guess this is one way to try to make sure we don't endanger them further.
Absolutely. So, one of our biggest concerns, right, at the very beginning of the COVID-19 pandemic, at least among those of us in kind of the veterinarian animal care community and conservation community, has been the health status of a lot of these populations, not just in captivity, so not just in zoos, but also in wild populations, especially those that are managed, because those that are managed, like the Mountain Gorillas Project in Africa, have a lot of contact with humans. And so they live in a space that's protected from development, but is in proximity to human settlements, to communities. And they also have people who are conservationists who go and monitor them. And there may be tourists that come. And so reverse zoonoses from tourists have been kind of well understood to be a challenge, for example, for some of these primate populations in the wild that are managed because they are susceptible to things like measles, right? And some of the cold viruses and influenza, that pretty much anything that humans can get may be a challenge for some of these populations. And therefore, if we want to keep these populations around in perpetuity, not only because it's part of good stewardship of the planet, and we've had terrible biodiversity loss, as you've recognized, but also because we don't know what importance they'll have, not just in ecosystem services that can protect human health in the long term, but also in terms of what insights we may have from their disease susceptibility or not for future pandemics.
And I guess, I can't let you go without talking a little bit about dogs and cats. I mean, at the moment, very few, I understand, are really dying of COVID. So it doesn't necessarily seem as though we need a vaccine for dogs and cats. But do you see that potentially down the road?
Yeah, I think that Zoetis started on this pathway right after the first dog and cat cases were reported, even out of Hong Kong, right at the very beginning of the pandemic. And I'm very glad they did, because I think it's important to have all options in our arsenal, especially if we start to see variants that are more adapted to animals. So right now, the variants that they've been getting are variants that transmit very well in people, but don't actually necessarily transmit as well in animals. And the big exception to this was the mink variant that had pretty good transmission in mink, and also, the change in the particular structure of this mink variant was in that spike protein, which is the target of the vaccines. And so because of that, remember, we had giant culls of mink in Denmark and the Netherlands. And we've also started vaccinating mink in the United States on farms. And so we know that about 17 farms have been reported to have had COVID-19 in their mink populations. There's been a lot of scrutiny on these. And as of this summer, the mink on farms were beginning to be vaccinated with this Zoetis vaccine. So I think that there is a lot of potential to protect animal and human health in that context. And we also, for dogs and cats, don't know what the future holds in terms of variants. And so I'm grateful that we have this in our arsenal, because if we start to see a variant that might emerge that maybe binds a little bit better to the cat or the dog ACE2 receptor and transmits a little bit better in dogs and cats and perhaps causes more disease, then we already have the infrastructure in place through veterinary practices and animal shelters and other deployment locations where we could hopefully scale up manufacture of this vaccine. It already exists, and then we could get it into the hands of our veterinary healthcare professionals who could help to protect dogs and cats. And this is also true if there are any animals on the food supply chain. We know that pigs maybe experimentally can get infected. There are some other species that we worry about a little bit with the deer being able to get it. Then it kind of opens up for all of the related species, which can include cattle. And even though we don't expect to see a lot of susceptibility right now, again, we don't know what variants may come out over the next year or 10 years, given the potential evolution of the SARS-CoV-2 virus.
Megan Davis, this was really fascinating. Thanks so much for joining me.
Thanks for having me.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.